So BMW. So BMW means BMW means BMW means BMW means biomedical waste management, comes under Ministry of Forest and Environment. And so first category is the black. So what are black? So in black we will use food waste and leftover, like the plastic vapor of the syringe and plastic cap of the needle, and garbages like doctor prescription is also uh, collected in the black cover. What we collected in the yellow color is soiled waste. We will collect the soiled waste like cotton swab, so liquid waste like sputum sample, and urinary bag like that, urine like microbiological waste, which includes sputum sample also. And in yellow bag we also collect discarded medicines and anatomical waste like blood bag. But in yellow bag, urine bag is not collected, because yellow urine bag is not collected in yellow bag, because yellow bag urine bag are sent to red color. So here you can see urine bag is collected in red. So PHC deep burial plus bleaching powder. For yellow wooden drugs, for yellow wooden drugs for cytotoxic drugs, and is sent it to the manufacturer. So red in red color, plastic, rubber, and plastic tube. In red color we collect plastic, rubber, and plastic tube. Okay. Do autoclaving for sterilization. So first we have to sterilize by autoclaving, and we can use them. And this is yellow color, we have to burn. Disposal is by incineration. Disposal more than or equal to 1200 degrees Celsius. So ringer lactate and normal saline bottles are usually thrown in red color cover, and uh, rails tube also thrown in red color. Mainly plastic, rubber, and plastic tube are thrown in red color. Rails tube and nasogastric tube and urine bag uh, also thrown in a red color tube. So mainly plastic, rubber, and plastic tubes. So while you can see blue color, we disposes glasses and metallic implant. And here the method of disposal is by autoclaving, weekend sterilization, and hardboard boxes like orthopedic implants, glass slides, stents are usually collected in blue color. And the glasses are recycled, and metals are reused, and some metals are crushed, and then we have to use and we can reuse them. And white color we can use sharp needles, sharp scalpels, and surgical blades are usually in a plastic box. So here autoclaving and shredding and recycle hard translucent plastic box is used in the white color. So for COVID-19 biomedical waste management, center Central Population Control Board under Ministry of Forest and Environment. Here the yellow color is usually we can throw N95 mask, surgical mask head over, or in yellow color cover, while PPT kit, goggles, and face shield are reused up to 5 times by using 0.5. So this is for PPT kit. PPT kit with zip is usually thrown in red cover, but goggles and face shield are reused up to the 5 times using 0.5 percentage sodium 0.5 percentage sodium hypochlorite to wipe surface of COVID-19 patients. 0.5 percentage sodium hypochlorite is used. Blood filled on floor is so If there is blood fill on your hospital, what you have to do, first pour 1% sodium hypochlorite and then dispose it to the um, nearest drainage. First we have to put 1% sodium hypochlorite and then you have to dispose it by nearest drainage. And disposal of mercury, we have to collect and reuse the mercury. And next is the disaster management. Disaster management comes under home ministry. So here the main person is the prime minister Modi. Mm, most common disaster in India is hydrological, which is flood, drought, which is flood is more common, but we have drought also. Preventive measures during disaster management. First, safe disposal of fecal matter. So first we have to do face safe disposal of fecal matter. Second is the chlorination of the drinking water. Next is so what happens when there is a disaster? There is an impact, and then the rescue and relief team comes, and then they will provide food and water, and after that they rehabilitate, making the people self-dependent. After that, we have to construct their buildings or their destroyed buildings. We have to reconstruction. This rescue, rehabilitation, and reconstruction is also known as together we called as recovery. And mitigation. What is mitigation? Decreasing future disaster and prevent construction of river. So what is mitigation? Preventing decreasing for future disaster and prevent construction of water. So and next is the preparedness. So we will alert the rescue team and alarm signal for the next disaster. So it is a cycle. The most common diseases during flood disaster is gastroenteritis, cholera, leptospirosis, rickettsial disease, and mosquito-borne disease. There is no vaccines are given during disaster except tetanus vaccine to healthcare worker. To healthcare worker. So there is no vaccine are given during disaster. Why? Because in that time the antibodies need to have some time to produce. So no vaccines are given during disaster. Next is the triage. 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 So what is triage? Classifying patients for efficient management. Red color for life-saving surgery within 6 hours, and yellow color for need surgery between 6 to 24 hours, and green color is ambulatory patients, and black is red or morbid patients. And reverse triage, this is done during war. The first priority is given to the green. Why the first priority is given to the green? Because if we recover in the war situation, if we recover green color triage people, they will help the doctors and they can go to fight. So this is known as reverse triage, which is done in war. And second period is given to yellow, and third is the red, and fourth is the black or death. Okay, what is epidemiology we will discuss later.